روح. صح صح. لعب يا اخي، لعب اسرع. شو ما يشتغل. روح.
أخي ملل يا أخي. أخي من موجود الحين؟ ما في لعب. خلينا نشوف عبود. شيء ما يرد. خلنا نشوف.
ضابط ضابط. ايش في غادي؟ ضابط ضابط ضابط. يا ابو عابد. الو.
كنت جاي من العمل وحسيت كذا ألم فوق الصدر جهة اليسار، وقلت هذا إرهاق أو مثل يعني تعب وهذا وبس، وأهملته لأنه راح. اليوم الثاني صار لي نفس الشيء بس شوي يعني شديد يعني زين، وحسيت بتعب وعرق وإرهاق وما شفت ضيق تنفس، وما شفت نفسي إلا أنا في المستشفى. بعدين سألت العيال، قال لي ولدي عبد العزيز إنه جاني وحصلني كنت طايح على الكنب. قلت له الساعة كم جيت؟ قال جيت على الساعة 9:10. يعني أنا صارتني الساعة 9، يعني خلال 10 دقائق، خلال 10 إلى ربع ساعة هو جاني وأنقذني الحمد لله وداني المستشفى.
Usually patients wait until they have problem, then they come see the doctor. Not people in this country in the Middle East have this idea of going to the doctor regularly to check their blood pressure and heart rate and pulse, and if they have respiratory problems, to talk to the doctor about them. They usually come when the problem or the disease manifests, and then they come to see a doctor.
زحمة على المواعيد، ومو بس المواعيد، زحمة بالطريق لما توصل هناك زحمة، ولما توصل المستشفى تاخذ يعني تنتظر احيانا نص ساعه احيانا ساعه على اشياء بسيطه ياخذون عليها روتين، يعني اشياء يعني كلها 10 دقائق يقول لك يلا روح. فلما يكون الجهاز هذا موجود بوفر عليه الزيارات هذه، بوفر عليه وقت، بيكون يعني القراءة مباشرة عند الدكتور، بيكون على اتصال مع الدكتور.
We do need to measure the vital signs of all our patients, and when we say vital signs, we mean the heart rate, the blood pressure, the respiratory rate, and the temperature.
Many diseases cause death around the world, and considering the interest and popularity of various devices, our project is to design and develop a compact wireless sensor for body area network, which will provide alternate solution to the vital signal monitoring method like ECG for heart rate measurement and for breathing rate measurement. In addition, an antenna is going to be built to propagate over the surface of the body, which will help in measuring the vital signal, high radiation efficiency, and low specific absorption rate, with some additional parameters is going to be used to build the sensor to guarantee the safety of the human body. Moreover, an application is going to be built to transfer the measured data from the sensor to the PC.
I was intrigued by this idea because I think it will fill a gap in some patients. We need to make sure that while they're at home, we are keeping an eye on their vital signs. And telemedicine is a principle that's very common now, and it's on the increase because we don't follow the patients at home. We want to make sure that the vital signs of seriously ill cardiac patients and even patients with less serious diseases are followed up while they are at home. Linking this with the doctor at home or in hospital is also a very good idea, because now with the technology and these different medical apps on the different Android and Apple markets are becoming more used in hospitals, so it will be very good to see how we can link this with patients at home.
Each technology, each devices that comes to the medical field, after testing it, I know it's an additional tool to the doctor to help diagnose and manage the patient to the proper way and help him get the benefited and reduce the side effects of any diseases.
إذا في جهاز مخترعينه جديد كذا يقيس الضغط ويعد ضربات القلب ويعطيك انذار مبكر ان في هناك في شيء، هذا جيد. يكون على اتصال مع المستشفى، يكون هم عرفوا ان ايش اللي فيني ويبلغوني ويرسلون مثلا اسعاف او يسوون يعني اجراءاتهم هذا ويتصلون فيني يقول لي انت في كذا كذا مثلا ترى مرسل لك الاسعاف الحين.
Most of the people who come late, it's unfortunate that they come with the diseases that could be prevented if they come early in matter of hours. This is a very big problem in this world and in the medical field in general. I can give you an example, like a patient with a stroke or a heart disease that can, if you come early an hour earlier, he can get the proper treatment to resolve the blood clot, the stroke, for example. So again, coming earlier to the medical care helps the patient to get the benefited and reduce the negative effects of the disease.
Yes, most of the serious heart diseases, time factor is most important, because a lot of patients, they are diagnosed late or they receive the medical care at a late stage of the disease. So every minute counts in treating heart patients. So if this invention help us that we can get the diagnosis early, definitely the outcome of treatment will be much better. Why not? If it's improved and if it complies with terms of work in the hospital environment, it's more than welcome that we can try it. All these medical devices started like this by invention, and then they are put on the practical environment. And if we make sure that the accuracy of measuring the vital signs is good, obviously we will be happy to use it in the hospital.
Having this device will make the process of the patient seeing a doctor faster, making the patients stay with the doctor less in terms of time, and so at the end doctors get to see many patients, help them, give them the proper treatment.
Definitely, space is very important when treating patients in the emergency department, because you need enough number of staff to deal with the problems of the patients, and our devices are a little bit bigger sometimes than the space around the patient. So having smaller devices that can do the same job will definitely save more room for the staff to deal with the patient.
اي اكيد بروح اشتريه طبعا. اذا كان انا اعاني من مشكله وفيني يعني احيانا تجيني الام وهذا، وفيني مثلا علامات المرض القلب وهذا، فلا بد ان بشتريه، يكون اسهل لي ويعطي انذار مبكر لي، ويكون على اتصال مع الدكتور حقي، وهو يكون عنده المعلومات وكل شيء.
As with all devices and technology, which I have limited sources to it, I mean information about them. The smaller the better, the user friendly the better. Especially with these diseases are, as you should know, it's an elderly focus. And most of the people are like in the older sector of the groups. So the more friendly, the more easy, the more accessible for the information for the patients, and it will be more beneficial for them.
ما يكون يعني ثقيل، ويكون ما يكون عائق على يكون عائق على الاعمال الروتينيه اليوميه اللي انا اقوم فيها، ما يكون عائق ولا شيء، لا بالعكس، راح ان شاء الله اخذه واحطه على صدري، لانه بيكون على اتصال مباشر مع الدكتور.